and welcome to our 11 a.m. session of the Health Philanthropy Summit, which is all about donor recognition. I'm Jennifer Wood, Senior Consultant at Health Giving. Whether it takes the form of a physical or digital presence, healthcare donor recognition remains personal. The most impactful installations and new media pay homage not just to the donor, the campaign, and the organization it supported, but also to the community and the era during which the gift was made. Our guest experts from 1157, a strategy, design, and build partner, are about to demonstrate to us how, as the needs of the donors evolved in 2020, thinking outside the box was no longer enough, but rather it became time to think beyond the donor wall. We're going to learn about the latest in creating donor environments, both physical and virtual, while also addressing ways to make budget-savvy choices that will still make a lasting impression of gratitude on your donors. First, from the 1157 team, let's welcome CEO Evelyn Flock and Marketing Coordinator Derek Spittler. Thanks for joining me today for this pre-taped segment. And in full disclosure, I have the photo package you sent, and I'm ready and excited to share them with everyone when you cue me.
Well, thank you very much, Jennifer. Derek and I are very pleased to be a part of this opportunity. So we're looking forward to sharing some of our experiences and providing some insight as to what your colleagues are experiencing. And again, we're very proud to be a part of the Health Giving Summit 2020.
Great, it's great to have you here with us. So let's get started at a really high level. What trends have you seen this year in donor recognition?
Well, as you mentioned, donor recognition must remain personal. With staffs being stretched very thin and social distancing still in practice, fundraisers are meeting the challenges in a very creative way. We are encountering some of the various modes that our clients are in the fundraising efforts. Steady and no major movement. They're just trying to kind of still be engaged with their constituents and their donors and prospective donors, and they're experiencing oftentimes a reduction of staff. So they're kind of slow and steady, just maintaining, if you will. Then we've got those that were in the midst of a campaign in the middle of the pandemic when it hit, and they hit the pause button. And we're seeing those now starting to reemerge, oftentimes with expanded initiatives or even redefining some of those initiatives. And then that third bucket are those ones that are full steam ahead, and they are continuing with their planned campaign, and even some situations even looking for new campaigns. So recognition takes on many forms, as you alluded to, whether it's physical or digital experiences, but it still must remain very personal. So I'd like to share some of the physical aspects of it. COVID is temporary, and both currently and very realistically, we need to follow the old adage, you meet people where they're at. So physical displays we're seeing branding coming more into view now. In the past, it was just maybe a logo and possibly a short statement. Now it's becoming part of the story, if you will, that's being generated through the visual experience. And rather than maybe a list of names, maybe we're creating a viewer experience. And we want them to see, what did they learn by looking at this visual. And when they walk away, we want them to take some emotional response with them to generate action of support. Derek, I know you've got a couple of things too that you're experiencing with regards to the physical displays. So what are some of the things that you're seeing?
Of course. Yeah, well, displays become a piece of art within the facilities. Foregoing the list of names and just placing them, start to place them aesthetically within a display to make that impactful for the viewers. Along the same lines, visual textures and lightings are making very impactful displays, such as some of the examples that Jennifer has to share on her screen. We have the College of Worcester, which we've implemented artisan moss within the display as a texture, as well as the Kettering, which we've implemented the lighting. So bringing in all of these different aspects bring a very well-received display.
Definitely, Derek. In creating, artful displays, we understand art is varied as people. I recently read a statement that said, art reaches out within ourselves through its expression, and then sharing art with the community can bring about the richnesses of those experiences. So that to me really resonates within a healthcare environment. Kind of following along the lines of community, we're seeing some of the physical displays actually giving a tip of the hat, if you will, to the community, by laying that foundation of gratitude much beyond the donors, creating a sense of pride and ownership within the community and within the community and the organization together. It's kind of like we're all in this together type of concept. And the illustration here that you're seeing, there's a lot of visual imagery, not only of community leaders, but iconic images throughout that particular environment.
That's a great example. Evelyn, where is that? And what part of the country is that from?
This is actually in Missouri.
Missouri.
Yeah, Cox Health.
Okay. That's really fantastic. So what sort of, go ahead. I don't want to interrupt.
No, I was just going to say, so that kind of is more along the physical aspects of things. Derek plays a huge role in our digital and virtual type of experiences here at 1157. So he may have some input with regards to some of that digital format that we might see in physical displays.
Sure, thanks, Evelyn. As expected, digital formats are definitely on the uptick. The availability to be flexible and have a large content vessel to store all of your information, to be able to access that from anywhere is very crucial in this time and age. Digital solutions are often a very successful way for a brand to build their image and entice the donors to recognize the giving. Incorporating innovative digital solutions are part of a holistic experience, and it's definitely a path to consider moving forward.
Again, I would agree. Derek, you meet the people where they are and consider digital experiences that come actually to their home. The Ohio AHP had a recent presentation with Bill Littlejohn titled Fundraising in the Midst of COVID 2019, Now What? And it was noted that electronic interactions are very powerful in these times. He also shared the importance of telling stories, not only for financial gifts, but other ways to support the community and the organization. So we all know about the impact of storytelling. Donors are becoming less interested in being recognized at certain dollar levels and more focused on wanting to know and being illustrated how they have made an impact. We're seeing an upsurge, resurgence, I should say, of QR codes. This is something that could be positioned on a display where the viewer can explore further and take that story with them. So these are just a few things, both physical and digital, that we're seeing some trends, some things that are happening.
I love that. So what challenges are you seeing out in the field? What challenges are your clients facing?
Well, I can only imagine. I'm sure I'm not going to be able to articulate truly what they're experiencing, but we are hearing that they're asked to perform with less. Less workforce, less budget.
Yeah.
And there does seem to remain a sense of some uncertainty as leadership may be redefining strategy. So, a little bit of being overwhelmed coupled with a very strong desire to stay connected, not only with their donors, but with their peers. So that human touch is now so critical, more now than ever. And since we're not really in that face-to-face mode, as much as I think many would like, personal touches are becoming much more creative. There's some challenges, but there's some great stories as well.
Yeah, I can feel that too. So where are you finding successes in helping your clients?
Well, defining, helping the client, that we start conversations oftentimes, or when we get to that part of a conversation, what can we take off your hands? How can we help you? And each client's responses are going to be very differently. They will respond very differently. Derek has been integrated into a program that we introduced not too long ago regarding updates. Derek, would you like to expand a little bit about that?
Sure. So many of our clients have faced reduction in personnel or reduction in hours. So one of the ways that we were able to accommodate to their needs was to implement an online ordering system. And with that, that reduces the amount of back and forth communication, ultimately reducing the amount of time needed to place an order. This also reduces the amount of proofing that's needed as it auto-generates a proof to have in hands for the client. And so, Evelyn, would you like to go into the next point?
Sure, sure, most definitely. We talked about, maybe some of our clients are engaging in a campaign, and they might be at the very beginning stages of recognition commemorative journey that they're traveling on. We're seeing that with less hours and people on your team, one of the ways that we can help is to help manage their time more effectively and efficiently. So by getting involved early on, by putting a designer involved in the initial conversations during the discovery engagement, creating look and feel and some of the thought starters with their key shareholders, it begins to set the stage for a total team approach, our client's team approach, as well as ours, and gets the buy-in early. And what I mean by that, it minimizes any additional meetings, reviews, any kind of change of directions, if you will. It gets everybody on board early on. And another thing that we've done in those types of exploratory modes is that we've created multiple options during that initial review. And that does also expedite the process. Timeliness is still king. COVID has provided some grace, but COVID again is temporary. There will be opportunities to meet within your facility, and people need to be ready to show them. Those that have found themselves maybe midway in a campaign, kind of where they hit that restart button, if you will, artistic renderings of the recognition display may jumpstart some of that enthusiasm of those maybe not yet on board. And it's also a nod to those that have committed to that particular campaign or that particular initiative, and thanking them. Seeing the handwritten notes coming back has been kind of a interesting phenomenon as well.
It has.
Yeah, and the last bit that we played I'm going to say a role in is discussing the donor recognition strategy. There's time now for reflection a bit within some of these teams, and able to help prioritize projects, create those short-term, long-term approaches to recognition. And working collaboratively with Health Giving, we can complement the plan with a visual path. Think about, what can we do now, or what do we need to do now to meet the needs? It might be naming opportunities, and maybe that display is later, that's put on hold, but maybe do some naming opportunities, or maybe it's some other type of outreach to donors, but create the overall plan. So when it all comes together, it all comes together. It looks purposefully. So those are just some of the ways.
Great points.
And basically, like I said, it's all driven by the needs of the client, and each one they're traveling different. They're different experiences right now.
So I know I've heard you touch upon this, but just to drive the point home, where are we headed in 2021, and are bricks and mortar donor recognition, are they still going to be vital?
Well, I have to say, of course it is. People are still going to be needing healthcare, and they're still going to be within the hospitals and facilities. Whether that is a newly constructed building or an existing building that work is being done to, there's always a story to share. Whether that is accomplishments, impactful connections, and the philanthropic gratitude that is displayed within. So I have to say, yes, donor recognition is still very prominent in this day and age.
So what sort of digital technologies have come to the forefront in this era of social distancing, even though it's so, it could be coming to an end. We're getting news of vaccines each and every day, but what sort of new technologies are we looking at here?
So we're seeing an uprise in the telehealth, but going back to my last point, I do not foresee the actual infrastructures to disintegrate or disappear within the future. Being in the era of technology, the 21st century, from cell phones to digital and interactive donor recognition, they're continuously being updated and evolved. There are many forms such as the interactive displays, multi-screen arrays, as well as the social platforms and countless others that are being utilized. Transitioning the interactive displays from a based computer system to an HTML-based, web-based content management system was key. This allowed users to be able to interact and access this content from anywhere at any time. So they're not having to be on the actual site that the display is on, whether that might be the hospital or care facility. This functionality was intentional, but it played out beautifully during the pandemic era.
Sure.
These digital solutions allow for more traffic and web presence, which is definitely key. This allows you to backlink to donation portals as well as social media, and this allows for ultimately more engagement within. As well as these digital solutions allow for precise measurement of web traffic using analytics. You can track what pages are most popular and being interacted with the most versus not. Ultimately, you can incorporate this in your return on investment strategy. And then lastly, we have seen a very popular platform, ThankView. This platform has allowed a personalized thanking to your donors via an email or a message that is pre-recorded. Once again, being personalized is very important.
That's fantastic. And what great timing that all of these things were in development and then you had them available. And I think people are really utilizing them now and they have a great future. So thank you so much, Evelyn and Derek, and we will see you for the live Q&A. Thank you so much.
Thank you.
Thank you.
So, of course, I know what you're thinking. If you're like me and you're trying to stay on a budget, all donor recognition costs money. And of course, so now I'd like to bring another valued 1157 team member into the conversation, John Cochran. He's Director of Sales, and he works one-on-one with healthcare clients on the East Coast. So, John, hello and welcome.
Hey, Jennifer.
Thank you so much for joining us. We've been talking bricks and mortar and new technologies, and all of that's well and good, but we would like to address the more practical issue of budget. These days, that's top of mind for so many. So could you give us some quick examples of donor recognition projects that have actually saved the clients money?
Yeah, Jennifer, as COVID has been challenging for a lot of the clients we serve, most of our projects would coincide with maybe a capital campaign or something along those lines. But I have had a lot of conversations regarding what our clients have existing in their buildings. And what you're seeing here up on the screen is a very interesting project. This display did not originate with 1157. It originated with what we would describe as an architectural signage firm. So the left-hand side, you see essentially some vertical rectangles with a listing of donors, a little bit of visualization behind it, and then some colored lighting schemes that would go in and out. And you just happen to ask the question, how much time and money do you spend on updating this display? Because they have several of these prominently throughout the main quarter of the hospital, and just kind of without even second guessing themselves, they said, oh, we spend 30 grand to update 5 of these bays. And to me, when I heard that seemed like an awful lot of money just to update a display. And so continue to ask questions. They had a lot of difficulty in the process of updating them. Some of them involved glass, and the glass would sometimes break when they were trying to remove these and ship them out. And
That can be
so
tricky.
it just
Yeah.
became very clear that they had just kind of accepted that this was the way it always was going to be. It was always going to be difficult to update. There was always going to be downtime where there might not be names displayed that maybe should be. And then that was just kind of how much it cost. And so I have these types of conversations all the time where we say, you know, what if we reimagine, or what if we retrofit the display? And so after a couple conversations with them, you'll see on the right-hand side, the retrofit preserved the existing visual. Basically, all we did was change the technical way that we were executing on how easy and cost-effective the donor updating could be. And basically, the price of one of those rectangles prior for them to update was about $600 some odd, and we were able to shave about 2/3 of that price off. And so they felt very pleased that, you know, they could go back to their team and say, you know, if I could save us 20 grand this year, would that be something that we could celebrate? And that money could go towards, you know, furthering their mission as opposed to just, you know, updating the display. And so that included retrofitting their 5 of these bays, including the one below in which we incorporated an interactive touchscreen display.
Wow. Okay, so just a point of clarification then. So this isn't for a particular campaign. This is like a live living document of all of their current donors, or tell me a little bit about that.
Yeah.
Okay.
Yeah. This is in their main campus hospital, very prominently throughout the entire main corridor. As soon as you come in, there are these, I describe them as bays, and most of the bays had 12 vertical rectangles a bay, and it just encompassed all of their giving, you know, capital giving, annual giving, giving societies, things of that nature. And they updated it once a year. And I would just say to anyone who, you know, I think it's easy to get into a routine, and this may be a really great time to just kind of take another look about what do you currently have in your facility. Is it meeting your needs, both from a, you know, is it easy for you and your team to manage over time? Because sometimes displays look great on day 1, but on year 2 and year 3, you wish it was a little bit easier to manage. So I always try to ask those questions. Then also just, you know, how much are you paying to update? Because, you know, the majority of clients we serve are nonprofits. And so, you know, we have not only that experience, but we hear, you know, we interact with folks on foundation advancement development teams all the time, and they've shared enough stories with us about frustration, about how past projects have gone, that we kind of know how to share best practices and incorporate that into the display so that it isn't something that years down the road becomes, you know, difficult to manage or costly over the lifetime of that display.
That's fascinating. We have to wrap up the segment, but I'm hoping you'll join us for the live Q&A, because I think a lot of folks are going to want to know more about this.
Sure
so
thing.
Thank you so much, and we'll see you for the live Q&A. So now we're going to move to the more inspirational side, and we're going to invite 1157 designer Dusty Arns to the conversation to give us a glimpse into the future of creating not just donor recognition, but a personalized donor environment for our clients. So Dusty, welcome.
Thank you, Jennifer. Excited to be here. My philosophy and approach are to add emotion, help accomplish and communicate the goal of the team, and then to new projects, really start the moment a client begins to speak. And from there, I have 4 steps in every project. Listening is number 1, and it's the most important. Most of the time, they'll give you everything you need to accomplish the goal. And sometimes you need to pry a little to get the real answers. And sometimes the client will tell you they want the display red, but they really want it blue, and not even realizing they're giving you that answer. So from there, step number 2 is the questioning portion. And the first of many questions, like what's the ultimate goal? There's who will be here. Not just donors will be here, but it could be employees and visitors. So the display will speak to different people in multiple different ways. Who will actually appreciate the space? Does it need to be tamper and weather resistant? Or is there existing lighting, reflection, wall materials, past projects? So the list goes on questions. And one topic that most find difficult to discuss, and we just spoke about, was the budget.
Right.
And we all know that everyone has a tighter budget, so we need to be aware of that and still create great designs with those lower budgets. So these are all types of questions that run through my head before I even really begin. And sometimes certain design elements can sneak into my brain immediately when I see the space. But when you really dig into the deep history of the display and what it is meant to be, it usually comes together really well. And so I move on to step 3, which would be to research. And once you get those answers, I dig into the research, there's obviously more questions. What parts of the building can I see this display from? From the main entrance? What's the first impression? What does it look like from where you're standing or right when you walk off the elevator? So from there, you start to create. And after plenty of questions have been asked and an extreme amount of listening, I scope out where I'm going to put the display and begin to visualize the project. Many times it's already been established for the location, but if a client says, somewhere in the lobby, I'll scope out on a floor plan my approach and the path that you will walk past it. And then pull in certain materials, maybe dimensional, visual textures, and start to communicate the design in a digital way. And we always need to keep in mind that most people also view proposals on laptops and iPads and iPhones. So being conscious of how our proposals view is very, very important. And I've always thought that personally, I think 50% of our concept is the real design, but the other 50% is how our proposals actually appear and how well we can communicate those details. So in the end, all of these steps need to happen, I think, and to really create a cohesive and personalized experience.
That's fantastic. And I know that you've sent us some gorgeous photos to look at. And since I'm not a design professional and you are, I've got to ask you, studies tell us that when stewardship is top notch, chances for a repeat gift are much higher. And so now that, we know how critical that recognition step is, talk to us a little bit about the power that effective design has to draw that person in and communicate that gratitude, but also having that job of educating us about what the money's supporting, and then finally inspiring that future giving, because that's all a heavy lift.
The power of effective design is driven by the experience itself and motivating others to give. To inspire future giving, I think there needs to be a positive experience and a return on investment. Continuing the experience throughout the environment will prove the value as well. I think when you can really affect the full space, it creates a different view and creates a more holistic approach to the facility itself, appearing integrated instead of just hanging something on the wall. Digital technology is also another way to continuously educate people of all demographics, and anything from touchscreens to video, projection mapping can all help communicate stories and inspire others.
So I think you just said, we need to do more than just put names on the wall, but would you take us through some of the most interesting and potentially inspiring elements of a donor recognition environment?
Yeah, well, I think there needs to be a stopping factor and a storytelling element to keep the visitor engaged. How to create an emotional impression, a reaction, a positive reaction, while the rest of the environment can really have an impact on the display itself. Ceilings, in my head, are one element that can have a massive impact on the environment. Many places have, standard 2x2 drop ceiling, but when ceilings are open concept, painted black, it really draws your attention to the display versus, the ceiling being white and bright. Sometimes it can have a literal connection to the display. I've seen ceilings with abstract lighting, horizontal wood panels, baffles, and they all connect well within displays. Elements that have tied into the environmental design are really beginning to be amazing though. A few examples I've worked on are within Division I athletics and healthcare. And one example here is we utilize high gloss panels with a deep etch for zinc nameplates. And the concept connects directly back to the facility and the modern direction of the program. Another one was recognizing a musician and a producer. And my idea was to create a musical touch utilizing cable and guitar strings and then the musical note cylinders, still keeping the modern feel to the rest of the facilities. A third is projection mapping, where you can project onto three-dimensional objects and easily update the content. You can flow around certain objects and even dimensional recognition displays, populating imagery and other content onto the nameplate display. Brigham and Women's Health initially wanted a typical donor wall, so we listened really well and proposed a news story idea to help take up a 3-story hallway with lighting and mirrors, adding a more personal touch to it. And this option itself, which is Appalachian State, we utilized river rock into the display and then added reclaimed wood that was actually cut down less than 20 miles away from this specific facility. So textures and materials can have a large impact, and using technology, we can really take all environmental designs to another level and create hierarchy, create continuation of the storytelling experience. And with the future of technology and interaction, I think donor recognition environments are really endless.
Thank you. Thank you so much for that. I think we could have done 10 minutes on each one of those slides, and I could have asked questions on and on. But the good news is that we'll be doing a live Q&A. This is a pre-taped segment, but we'll be doing a live Q&A at 11:45. So stay tuned for that. So thanks to Dusty for getting us so excited about what the future holds in donor recognition environments. I'd also like to thank Derek, John, and Evelyn for providing their expertise as we took a look back at 2020 and a look forward into 2021 to see what the future holds. Stay tuned. As I just mentioned, we'll have all 4 of our experts on hand for a live Q&A to wrap up our session. And as a reminder, you'll be able to ask your questions in the live chat or via email at jwood@health-giving.com. And with that, thank you for watching, and we'll see you in just a moment.